Assalamualaikum warahmatullahi wabarakatuh. Good day, everyone. My name is Hasyim, and in this occasion, I would like to present our study, which is titled Knowledge and Progress of COVID-19 and Diabetes, Overview of the Problem. First of all, let's have a look at the recent statistic, which found that diabetes is quite prevalent among patients with COVID-19. It was around 20% of hospitalized COVID-19 patients has been diagnosed with diabetes as well. It is also worth notice that diabetes has been proven to strongly related to higher fatality rate, higher demand for intensive care, and finally also triggers higher mortality rate among COVID-19 patients. Interestingly, discussions and publications is still progressing, keep on going up until recently. Therefore, it urges us to stay up to date with the latest evidence. Therefore, this study aims to identify, compile, and articulate the latest evidence around diabetes mellitus in its relation to COVID-19 infection. We use the scoping review approach with the focus of the study on 3 items: diabetes course of treatment, patients with diabetes immune response, and finally the glycemic response and the interaction of COVID-19 therapy with diabetes. The literature were obtained from the electronic research database, ProgWest, EBSCO, and Science Direct, and we use the combination of keywords including the COVID-19, diabetes, outcomes, complications, manifestation, mortality, and pathophysiology. One set of particular criteria has been applied, as you can see on the screen, and the scheme below illustrates the process and the results of the literature search, in which initially we generated 89 references, and after the first stage of sorting, we generate 60 references, and following the second stage of sorting, we obtain 35 results. The final process is the critical appraisal using the evidence-based tools developed by the Oxford University, and finally we generated 31 references that has been considered as suitable within the context of this study. Let's move to the results and the discussion. The first theme that emerged is the treatment course. We found that patients with diabetes tend to have higher possibility for ICU admissions, where in the treatment, certain factors has been identified as crucial in predicting the ICU admission. They are age, C-reactive protein values, myoglobin, ALT, AST, as well as the increase in respiratory rate. It was also found that patients with diabetes possess higher level of infection risk, mostly due to bacterial infections, and mainly involve respiratory, GI, urinary tract, skin, as well as soft tissue in conjunction with the COVID infection. It was also important to notice that the prevalence of diabetes has risen dramatically from 5.3% until the latest one is 19.7% mortality rate among people who die with COVID-19 and diabetes. Another interesting finding is about the particular immune reaction, which was found that patients with diabetes demonstrated higher inflammatory index compared to those without diabetes. These include the parameters of white blood cells, procalcitonin, CRP, and ESR. It was also found that there is an open overproduction of pro-inflammatory cytokines to a massive degree, which end up to a so-called cytokine storm phenomena and higher in people with COVID-19 and diabetes. Another finding is that there is a lymphopenia among patients with diabetes, and this correlates with the lymphocyte dysfunction and increase the disease severity. Another important finding is that there are marginal and almost negligible difference of antibody expression among COVID-19 patients with and without diabetes. This may imply that vaccination will be very likely to be beneficial among patients with diabetes because they can still provide sufficient antibody following the vaccination. The third finding relates to the glycemic effect, which was found that COVID-19 may have diabetogenic effect, or in other words, it may trigger diabetes, as it has direct effect on metabolic organs, including the beta cells of the pancreas. Therefore, it was found a newly emerging diabetes or deterioration of pre-existing diabetes. Another finding is that the exaggerated inflammatory will create hypermetabolic stage, which in turn will increase insulin resistance and accelerate the gluconeogenesis. Finally, this process will make the blood sugar target achievement to be very, very difficult. Another important finding is that metformin, the first-line medication for people with diabetes, has been strongly associated with more life-threatening events, increased risk of disease progression during hospitalization, and higher ICU admission rate. Therefore, the use of metformin should be very, very, very carefully determined and considered by the treating physicians. From this finding, it was certain that there are need for specialized strategy to be implemented to tackle the potential problem that emerged among COVID-19 patients with diabetes. The strategies may cover the early screening for COVID-19 patients with diabetes, as well as early intervention protocols, the allocation of human resource to treat people with diabetes, and with the responsible knowledge and skills in regards to COVID-19 and diabetes, and also the support of medical facilities. As a conclusion, there are three important things that we have learned from this study. The first one is COVID-19 triggers exponential rise in the systemic inflammatory reaction among people with diabetes. The second conclusion is patients with diabetes tend to have worse condition, as indicated by the increase in the ICU admissions and the significant increase of mortality rate. Finally, COVID-19 has been proven to be influential towards patients' blood glucose stability. Thank you for your attention. I'm Ahmad Hasyim Bisono. Wassalamualaikum warahmatullahi wabarakatuh.